Joining us on the blend this morning, we have Allie Blondell, who is the Director of Rehab and Occupational Therapy at the Lloyd Ganton Retirement Centers. Allie, thanks so much for joining us. I'm wondering if you can talk a little bit about how important it is to educate and talk about fall prevention.
Definitely. So September 23rd is National Falls Prevention Awareness Day. So we're just kind of starting early here in September to kind of bring awareness to the community. It is so imperative that we start early in identifying our fall risks, especially as we age. The sooner we can identify our fall risk factors and how high up in the categories that we fall, we can prevent them and help kind of start the process of looking at different ways to get stronger or make modifications to our home or how we do things, talking to our healthcare providers before a fall does occur and something else could happen. It's just the number one way to start early and start identifying.
Absolutely. So it's kind of like a fall risk assessment, correct?
Yep. So a lot of places around here and talking to your healthcare provider, whether it be a physician or a physical occupational therapist, a nurse can run you through a quick fall risk screen. Usually takes a couple of minutes. They ask you questions, or anywhere from your medications to if you're feeling weak or unsteady, and then they kind of run you through a couple of quick assessments to kind of see where you fall. It doesn't take long and it's not hard. Pretty much anyone can do that.
Well, what if you're in between that moderate and high risk category? Then what happens?
Yeah, so if you do a fall risk assessment and falling into that moderate to high risk category, that's kind of your number one indicator that you should start looking at a fall prevention exercise program, working with some therapy to get you stronger, and just learning how to identify all those extra risk factors, which could include weakness, balance, your medications, whether it be other diagnosis like maybe you're diabetic, or if you're noticing some cognitive changes can also lead to a fall risk factor as well.
Are there some risk factors that can increase your fall? I guess you kind of explained that against with the medicine and everything like that, but are there external things too that you could do, like get a cane or a walker or just kind of plan for that?
Definitely. Working, with a therapist can help identify, what assistive devices would best be needed. A lot of therapists can come out to the house and do a home safety assessment too, to kind of look at those things to make modifications to your house.
All good information. Thank you for what you do. We're going to put your information on the screen, Allie.